Kenneth Harper. And Kenneth Harper is somebody that has been in practice for, I think, somewhere around 40 years. And Dr. Harper, maybe tell us. I mean, you've seen a lot over the last few decades as a doctor. What is it about this that has you excited? And maybe just I'll mute myself and let you take over.
Trent, thank you so much. When you called yesterday to ask if I'd be willing to speak, I said, of course. I don't come from a medical family, but at a young age, before I started school, I kind of had this calling to be a physician. I can't explain it, but that was that. I was in pre-med in the first grade. That's kind of crazy, but true. But what I noticed about, if I think back about the children in the first grade with me, there were probably 35 students in the class. Yeah, classes were big. There was one teacher, but everybody was fairly normal size. There may be one kid out of the 35 that's maybe a little overweight. But when my kids, who are now in their 40s, were in school, the ratio had shifted a little bit. But now about 30% of the children in our elementary schools are pre-diabetic, obese. And then looking at my practice, I'm a general surgeon, and I practice general and vascular surgery from my first 12 years in practice. And then I'm kind of an entrepreneur spirit, and I was looking for something else to do that maybe would have a better long-term career financially to support my family. And kind of God led me into doing varicose vein work. So I've treated varicose veins, spider veins, and leg swelling, venous leg ulcers since about 1996. Eventually, I closed the door on my general surgery practice, which is like jumping out of the boat without a life vest in the early 2000s. But over time, I'm seeing more and more of my patients that come in that are obese or morbidly obese. A lot of them have chronic metabolic disease. Now, I didn't really know what that meant. I'd heard about it, I'd maybe read a little bit about it, but I wasn't very familiar with it. And I myself had struggled a little bit with some weight issues, but really no serious health problems. I tried some different ways to maintain my health over the years. About 5 years ago, I did a program that was basically after a while, I said, I'm just kind of starving myself, shakes and bars, and I wasn't eating enough. And one day I was thinking, this isn't sustainable. And, our phones listen to what we're saying. And I got this message from Yvette, who had been a nurse in our area. And she was talking about metabolic health, and she was talking about a natural way to deal with it. And I began to learn from her and from Trent. Thank you for both, and Shannon, about metabolic health, about insulin resistance. Heck, I didn't even know you could measure your insulin level. So after a while, doctors sometimes are a little skeptical. I studied, I was listening, and Yvette was probably saying, hey, come on, just try it. And I joined, and I started using Unicity. And it really made a difference in my life. I checked my insulin level, and it was 6 or 7. And Yvette said, hey, that's way too high. And I said, okay. And my testosterone level is about 2, right? And that's way too low. And over the next 3 months or so, my testosterone level went up to about 6.5, 7. And my insulin level went down to 2. I was a believer. And I was I'd already been thinking about my practice about, we have all these patients that have metabolic disease with all its various forms that Trent did a great job of explaining. And I need to tell them. We were at a meeting in Nashville, and one of the speakers there was talking about, he was talking about, if you had something that could save somebody's life, wouldn't you share it? Just like if you were in a house and it was on fire, wouldn't you tell the people to get out? And so we started sharing this with our patients, and I started sharing it with my friends. And it's easy to be passionate about something you've seen has made a big difference in your life. And we have patients that are joining in. We have some of our staff, a lot of my friends, and people that I've met just by doing the videos that Trent taught us how to do. But this is life-changing. This is life-changing for me, for my family. And I'm so glad for people like Trent and Denise and Shannon and Yvette that went out there to share the message with me. And I would encourage you to share the message with your friends and your contacts, and follow Trent's system and Yvette, and listen to your coaches. because you can save lives too. And it's been my privilege to be in on the kind of the beginning of this. I think I've been a partner for about 6 months, and I've kind of, some people jump in and like in a month they're like diamond or something, but I've been steady at it, and I'm learning a lot, and it's made a difference for me, and it could for you too.
Well, Dr. Ken, I mean, you're giving way more credit to me than is due. I mean, I can say anything. I'm not a doctor, so people don't criticize me, but you to do this have been very brave and bold, and we're grateful for you. Thank you, Dr. Ken Harper. Great to meet you like this. I know we've met before, but it's great to hear you share your story. So thank you, doctor. There